All right, thank you. So we will start. I'll call the meeting to order. And our first item on our agenda is approval of the Zoom video from August 18th, 2022. Can I get a motion to approve the Zoom meeting?
So moved.
A second?
Second.
Thank you. All in favor?
Aye.
Opposed? Abstentions? All right, it carries. Thank you. So I will turn it over to Dr. Mahdi for the COVID-19 update.
Good morning, everybody. And no, I have not installed curtains in my office. I am joining you today from Washington, D.C., where I am representing the mayor at the 2022 National Maternal and Infant Health Summit. I'll then be going to Chicago for the Women in Medicine meeting. So it's good to be back to in-person meetings safely still. And so just proud to be representing St. Louis. This will be the last COVID-19 update that I do separate from the Department of Health meetings. If Matt Haslam is on the call, could you come on camera if you're able to? I just wanted to say that since the beginning of the pandemic, Matt has done all of the epidemiology around these reports. He has prepared these slides. The work that he does both in front of and mostly behind the scenes cannot be overstated. I want to thank him, and I'm sure this board thanks him for these literal every month for 2.5 years that Matt has done this, not only for the board, but for the city of St. Louis. We honored him as our employee spotlight a few weeks ago, but I just wanted to say ahead of this being the last separate report that I will do, there will always be a COVID-19 report as far as departmental updates. But we've reached the point where we believe that that may no longer be necessary. If anything changes, I will, of course, resume those as a separate agenda item. So thank you to Matt and the entire epidemiology team, Dr. Moshe as well, who leads the epi team. So Kim, if you could bring up the slides, we can get started with the COVID-19 update.
And if you could just confirm that you are seeing the correct screen.
Yes.
Thank you.
So this is the St. Louis City COVID-19 epidemic curve. And as you can see, the average daily case count has decreased by half since mid-July, now down from 100 cases per day to roughly 50 currently. So this trend is very encouraging, but there may be evidence of a small rebound after the first few weeks of school. As you know, we've had over the past 2 weeks in waves, different schools opening. The trend over the past 2 weeks is no longer decreasing and has instead plateaued. So we're keeping an eye on that. Hopefully this is temporary and we will continue to see a decline until the late fall. Next slide. Here we show you the Missouri state versus the sewer shed COVID cases and fragments in our sewer shed data. Monitoring viral load in wastewater has always been a helpful surveillance tool that does not rely on people going for testing. I've told you that testing has significantly dropped over the last couple of months, well, since January, really. The most current data for sewer shed data shows viral load peaking in mid-July and has decreased pretty rapidly across the state since then. This trend is in agreement with the decrease in case counts that the city has seen over the past month. Next slide, please. This is just another view. Recent site-specific sewer shed data shows decreasing viral load for 3 surveillance sites in the St. Louis region, as indicated by the green circles on the map on the left. And there were no sites in Missouri with significantly elevated viral load, and that's the map on the right. These trends provide further evidence that transmission is slowing down across the region and the state. Next slide, please. Let's talk a little bit about the Omicron variants of concerns. Omicron subvariant BA.5 continues to be the predominant variant in the community. It makes up approximately 79% of all new cases in HHS Region 7, of which we are a part. The newest variant of concern, BA.4.6, has been increasing in recent weeks, and Region 7 has the highest level in the country at roughly 18% compared to 9% nationally. rapid transmission from variant to variant can continue, and it can contribute to a sustained high level of infection. Slowing the spread of getting vaccinated, especially with the new bivalent booster, can help limit the number of hosts the virus has to mutate into these new variants. Next slide, please. So this is the COVID-19 case density by ward and region. The brightest spot by far can be found in the Central West End. Proximity to BJC hospital system is likely contributing strongly to this bright cluster because of the routine testing done at these larger institutions. Two other bright spots can be seen in the Shaw and Bevo Mill neighborhoods, both of which had an increase in cases associated with congregate living facilities. So again, underscores the need for us to focus on our higher risk communities, of which congregate living settings and the older population are two of those risk populations and risk settings. Next slide, please. So here we're looking at the COVID-19 case demographics, and we're looking at case rates by age. Rates have dropped for every age group over the past 2 months, but recently school-age children and young adults age 18 to 24 saw sharp increases associated with the start of the new school year. The increase in ages 0 to 17 coincided with the start of school for grades K to 12 in the 3rd week of August, and the increase among young adults coincided with Labor Day weekend shortly after university resumed sessions, and we always see increases in cases around major holidays. Next slide. So now we're looking at the COVID-19 case demographics, these case rates by race. Currently, Asian residents have had the highest daily case rate at 25 cases per 100,000 per day, followed by African Americans and Caucasians at 13.6 and 12.3 cases per 100,000. The latter two races have experienced a steady decrease over the past 2 months. Asians have been following a similar trend, but has experienced a spike in cases over the past few weeks. Similar to the age spike shown on the previous slide, this rise may be in part related to the start of school and Labor Day weekend social gatherings. So we've been really intentional about monitoring this because it's been an increase in this population that is both new and has been consistent. And so we've reached out to leadership across the city, and Matt and I have been engaged in education and outreach so that they can inform the community, encourage vaccination and other mitigation strategies. Next slide, please. So this is the CDC community level metrics. Currently, the city is in the medium risk category for the CDC's community level metric due to a drop in the number of daily cases of the last several weeks. This metrics, the community level, also takes into account hospitalizations, not just transmission. So hospitalizations remain elevated across the region, but hospitalizations are a lagging indicator. So it takes time to see an effect of fewer cases. And so if this trend continues, it will help us to, if this trend continues, we expect that hospitalizations will decrease as well. And we're now starting to see that decline. So that is something that we are grateful for. And so, what we'd like to tell residents here is that they should weigh their personal risk and take precautions as necessary. In addition to getting vaccinated, wearing a face covering when indoors and around vulnerable people, social distancing, practicing hand hygiene, and improving ventilation are all good strategies for reducing risk of infection. So now we're looking at the trends in hospitalization across the St. Louis region. Given the current improving COVID situation, the pandemic task force has actually decided to no longer provide hospitalization updates. Transitions are hard for the community, and we got an inflow of feedback about how helpful our weekly COVID updates are. So I spoke to Dr. Garza, who has been just an incredible leader for us in general, and as heading up the pandemic task force. And he expressed his gratitude to the city, continuing our weekly COVID-19 updates that we do across all social media platforms, our dashboard on the website, and these reports that I do here. So we have that in the meantime while folks are adjusting to the new normal. Instead, the data shown here are from the CDC. So when we look at these trends in hospitalization, while the number of new hospitalization is still higher than our target level of 10 hospitalization per 100,000, which is the blue line. Recent data shows a modest downward trend across St. Louis regional hospitals, a trend that we hope to continue over the next several months. And like I said earlier, this always lags behind our transmission. So now we'll look at St. Louis City COVID-19 deaths. Fortunately, COVID-19 case fatality has fallen over time due to the improved immune protection conferred by vaccines and natural immunity from prior infection. This decoupling of cases and deaths can be observed when comparing the Omicron wave this past winter, that you can see there around the December through January period, and that of the number of deaths during the Alpha wave the previous year. There were fewer deaths as a result of the Omicron wave, despite having far, far greater number of cases diagnosed. So that just underscores how natural immunity coupled with the immunity conferred from vaccines is so impactful. We've seen very few deaths over the past 6 months, despite being in the CDC's high community level for much of the summer. So now I'll talk you through vaccination rates. Overall, vaccination rates have improved to 3/4 of the population having received a first dose and 60.8% having completed the primary series, and a bit less than a third have gotten a booster dose. A fourth dose or updated booster is recommended for eligible residents age 12 and above who received their last vaccine dose at least 2 months ago. So more at this at the end. So whether or not you see me doing these reports distinctly, whether or not you see people reporting less on COVID, our communicable disease team and the Department of Health in general is still very committed, and COVID continues to be a priority and will continue to be one for at least the next year for us. What happens when something is transitioning from a pandemic to an endemic state, which we are still in transition, that has not happened formally, takes time. And so for health departments, that prioritization will increase while maybe the public starts to transition more quickly in their minds. And so part of that is making sure that that 1/3 that you're seeing for booster doses has to go up significantly, because the primary series no longer confers in any way impactful protection against the current variants. And I'll talk about that a little bit later. So let's look at booster rates by geography. Zip codes in North St. Louis continue to lag behind Southwest zip codes in being up to date with vaccinations, which means getting a booster dose. And that's on the map on the left. The pace of booster doses is slowly going overall, but the greatest rates of change were in northern zip codes. That's the map in the center, indicating the gap in booster doses is slowly closing. This is important for health equity because geography is highly correlated with both race and social vulnerability. Pediatric booster rates, the map on the right, are considerably lower, 11.5% citywide, and that's why this is a critical priority for us, and more on that later, and display a similar geographic pattern to the general population. DOH is partnering with schools to bring vaccines to students and to keep children and teachers safe. So this will be my last slide before I open it up to questions. Pfizer and Moderna have reformulated their booster vaccines to provide greater protection against SARS-CoV-2. In addition to protecting against the original wild type strain, the boosters specifically target the BA4 and BA5 Omicron subvariants that are currently circulating. For individuals who've completed their primary series with the monovalent vaccines, or at least received a booster dose at least 2 months ago, Pfizer's updated booster is available for those 12 years and older, and Moderna's updated booster is available for those 18 years and older. We have ordered and have in stock our new booster. We had to cancel clinics over the last 2 weeks because we had the old stock. We will now be resuming our clinics in partnership because we've seen, we were showing up wherever we were asked to go, but when you open a vial, that's it. You can't use that vial anymore. And sometimes you would only have 1 or 2 people show up. So we are being very, very specific about showing up about collaborations that we are ensured at least 20 or more people will be there so that we can maximize. And so we're being much more intentional with maybe fewer but more high impact collaborations. And so again, please reach out to me if you know of people or want to collaborate through your entities or other groups. I've been making the same plea to our elder men and women, have not received a lot back. So we'll make that a little bit more firm. but schools have been such a great partner for us. And we already have a request from SLPS to do some booster collaborated events, so encouraged by that. I'll stop here and take any questions or open it up for feedback and dialogue.
A quick question, Dr. Maddie, about formulations that include influenza with the SARS-CoV-2 vaccine. What's your take on those and when will they be available?
We have not been given indication when those will be available. For me, the safety and efficacy is the only thing that we need to be concerned about. Once that is in play, for me, that would be incredible because it would really allow us to protect people in a much more effective way. Flu season is upon us. Flu vaccines are out. We are going to have a sustained campaign through the winter because the only way that we will lose this incredible trend that we're enjoying, Dr. Ross, is if we do not pay attention to the fact that not only flu season is upon us, but there are a slew of other respiratory viruses. You know, everybody knows I'm an infectious disease doc. I have to pay attention every winter in the hospital to the viral panel for respiratory illnesses that includes at least 20 different players, right? And so the mitigation strategies that keep us safe from COVID also keep us safe from those other entities, but flu being highest amongst us. So it's very important for us to be clear about the fact that from now through winter and into the beginning of spring, it is crucial and critical for us to encourage both vaccination of flu and COVID-19. But those types of formulation, Dr. Ross, are exactly the type of innovation and public health impact that will really help us to protect people.
Tim, I see your hand is up.
Yeah, Dr. Monty, a great report and congratulations to you and Matt for all these work that you've done. And you actually just went to the place I wanted to ask about, which was influenza. And I thought maybe you could talk about it later, but since you brought it up, now that we're all emerging and coming together and schools are open, you know, I think we really haven't had much of a flu season the last couple of years. And it's probably because of those mitigation strategies.
Exactly right.
And so I'm wondering, you know, so I think we do need to ramp up our efforts on that. So I'm glad to hear that. Just as a question to an expert infectious disease doctor, is there any literature about what a flu season looks like after a pandemic like this? Probably not.
No, this is unprecedented, but you know, you're right in being concerned about the trend. We saw historic decrease in both influenza counts, but specifically in mortality last year. We enjoyed that because, you know, if you think about where we were, we had just started rolling out vaccines. And so mitigation strategies around lockdown, around specifically masking and around social distancing were the highest and most compliant that we'd ever enjoyed, right? And so I fully expect that we're going to see a bump. To what degree depends on how much people, especially in congregate settings, schools, congregate living facilities, and high level and high number events are going to be compliant with masking and social distancing. And from what I'm seeing and experiencing as someone who just traveled through 2 major airports, that has gone down significantly, right? And so I think we should anticipate that this is going to be a different and unfortunately higher transmission. And with that, possibly an uptick in deaths as well for flu and other respiratory viruses. But the protection that can be conferred from the vaccines, for those that choose to mask indoors, for people that are smart enough to understand that when the transmission numbers and those CDC metrics go up, that they immediately go back to masking indoors. If we can do that and do so impactfully, then I think we're in a good place, right? But people need to understand that the priority must be, first and foremost, vaccination for both flu and COVID-19, boosters if you're eligible, and then masking indoors. You know, here at the city of St. Louis, we continue to mask indoors. I continue to do so as well, especially in crowded settings. It's not a difficult thing to do. My 5-year-old does it with ease and chooses to do so still at kindergarten. So I'm a proud new kindergarten mom, and my child goes to school, and some people exercise their right not to, but she masks and does great in school. And as soon as she runs out for recess, takes it all off. So this is something that we can do and continue to do. I think that the other thing that we don't talk enough about is also just not showing up places if you have symptoms or you feel ill. Stay home, So I think it's a great point that you've given. We don't have data available that I'm aware of, but I'll go back and look at if such data was looked at after, especially H1N1, and see what I can report back, because I think that would be really interesting to know. So thank you for bringing that up, Dr. McBride. I'll look into it.
Yeah, I guess I was thinking about it. I was talking to my wife about it yesterday, because as you're the expert, so I'm afraid to talk here, but how flus come, they come from, other parts of the country, other parts of the world. And, since COVID's not quite done in that part of the world either. So I just wonder how this is going to play out. But I also, to your point, I saw a story yesterday that there was been a pretty significant outbreak of flu in Illinois.
Yeah.
So we need to really it's pretty close. So we need to pay attention.
Other questions? So Dr. Mahdi, I know it should seem obvious, but do you feel like the messaging that we have around the mitigation strategies can be, I guess, expanded or adjusted so that people understand that it's not just for COVID, that we should just be doing this because of the flu season and other,
I love that you said that, because for me, innovation is key. While the PIOs, Harold, Kim, and Jasmine, who are on this call, have done a phenomenal job. I'll be showing you some incredible statistics around what they've done to increase education and communications in general for the Board of Health. Innovation is always key, and meeting people where they're at and understanding what's the touch point that we need to maybe pivot to be more impactful. So we've gone into contract with Peoples and Dwayne Butler and Peoples to do a COVID-19 sustained communications campaign. More on that. I'll do a dedicated presentation on that if asked to in the future. Especially since the slot is opening up. But they're doing surveys for us in the community. They're partnering with our PIOs and DOH to do specific education, meeting people where they're at. So it's both a canvassing approach, an in-person approach, but getting feedback as we're educating people. And I really think that's gonna help us to do exactly what you asked, Chairperson. So I'm glad you brought that up, because I think it needs to be top of mind. As we're thinking about how to be impactful throughout the winter season, that we're also trying to change the way that we talk to people, understanding that they're at a different place now than they were 6 months ago, a year ago, and certainly 2 years ago.
Thank you. Any other questions on this agenda item? If not, thank you, Dr. Mahdi. We will move to our committee updates, and we'll start with the Governance and Nominating Committee.
Good morning. I appreciate the opportunity to update the board on the work of our committee. Our most pressing matter right now is that we have 5 board members who are departing from our ranks, and we're very sorry to be losing them. Sue Kendrick, Dr. Louise Jufra, Paul Lee, Keon Gilbert, and Lisa Richter will all be terming off in early 2023. So we have 5 spots to be filled. Our committee would like to open it up to our full board to receive nominations for candidates that you believe would be a good fit for our board and its work, and certainly representing important constituents within our city community. We are losing board members that represent, I think, key interests here for our board that we will want to keep represented. Sue Kendig is a member of the nursing profession, and she feels strongly that we should continue to have someone from that profession present on our board. So we would like to think about that. Dr. Jufra's expertise in addiction medicine is unparalleled. I do believe he has a candidate in mind who has also been very active in both in practice and advocacy for in addiction. And so we may have someone to consider there, but if you have other addiction specialists that work in the city, we certainly would want to consider those people for our board. We're losing Paul Lee, an important representative of our Asian community and chiropractor. We're losing Keon Gilbert, a member of the SLU community. So we will actually not have someone from SLU on the board, I don't think, once we lose Dr. Gilbert. So we may also want to think seriously about someone from the SLU community, because I do think we should have the major hospital systems represented. We do have Stephen Scott from SSM. And of course, Dr. Ross from and Dr. McBride from WashU. We're also losing Lisa Richter, who, as you all know, has brilliantly headed up our communications committee, and has also offered her expertise in marketing and branding and many other gifts to our board. So I will send out an email to the full board asking for your nominations and providing my contact information. So in hopes that maybe you would like to suggest some nominations for our board to consider. Once we have a slate, we'll bring the slate to you for a vote and approval. And then we will look to start our board members early in 2023, as I think your terms officially end at the end of February in 2023. And happy to take any questions about, I also want to mention that I think our president, Serena, is also working on a board grid of talents that we have and those that we don't have. So that will also be informing our efforts going forward.
Dr. Mahdi?
I just want to, say formally, wow, hearing it, it feels like you've been hit in the chest, because these are folks that have contributed to this board, to this community for so many years, whose work is so important. So I really want to say thank you. And to say that I'm just so glad to hear, Linda and Serena, that we're going to be real intentional about their legacy, what they represent around community, making sure representation matters, right? And so I think that's key. So I just wanted to say that I fully support that. And I want to make a concerted effort to try to make some nominations and even speak to those folks ahead of time. But just wanted to say that I think it's important that we acknowledge that this is going to be a significant loss, and that type of change and the reason for it is understood and important. But wow, that's significant. So yeah, just felt that.
It is. It's a big, we have only 13 board members. So to have 5 very talented individuals rotating off at one time is, will change the character of our board significantly. So.
Any questions? I will say, Dr. Mahdi, I had the same reaction, and Linda calmed me down. She's so thorough, and she has a good process for really making sure that we get the right people in place in time for next year. So. All right. Thank you, Linda.
You're welcome.
So our next committee update is Academic Public Health Collaborations Committee.
I don't think we haven't met formally since last meeting, so I don't think I have anything to add. I think I will say to my members of the committee that we probably should get together, because I think we have some unfinished business. So that's mostly what I want to say. Maybe I just want to make a quick comment on Linda's report that from the academic side, I think the point about making sure we have representation from SLU will be important. I also think we've talked in the past about UMSL as well. And, you know, Sue Kindig, when she first came on the board, was from the nursing school at UMSL, and I think we had some ideas around UMSL. So I think we should think about that as well.
Yeah, I'm glad to see Keon say he's going to make some suggestions, because that's really important to me as well. And I'll also like to add that for me, Harris Stowe is important, our historically Black college and university right here in St. Louis. So I will definitely commit to reaching out to President LaTanya Collins-Smith to discuss potential candidates from Harris Stowe. But I think we have some opportunities here, and I definitely trust and value Keon's background, Keon's recommendations as well. So thank you for that, Keon.
Yeah, and I guess I just also wanted to mention that previously we've had a board member who has been a member of the St. Louis Medical Society, and we had one board member who has since rotated off the board who was a member of the St. Louis Medical Society, but we would also welcome any nominations for persons who are involved in that particular body.
Okay.
Thanks.
Okay. All right, and our last board committee report is from the Health Communication Committee. Lisa, I don't know if you want to share what we discussed, or if not, I can give everybody a summary.
Why don't you do that, Serena? Thank you.
Okay, so one of the things that we've been looking at as we're preparing for our board orientation in October is the utility of all of the committees. We have these 3 committees written into our bylaws, so we always make sure that we have board members serving on these committees. But we're thinking about whether or not this particular board needs to have a standing communications committee. So we wanted to have a discussion about whether or not people feel like there is utility or work that needs to happen that requires a standing communications committee. Lisa and I are of the opinion that this is probably a committee that can be dissolved or at a minimum removed from the bylaws. And what that would mean is that if there is a task that requires us to assemble to discuss communications, we could always have an ad hoc committee or a specific meeting related to it. But it wouldn't require board members to consistently serve on a communications committee if there's not a specific function that the committee is playing. So that's the conversation that Lisa and I had. I checked with Linda about the process for if we decided to dissolve the committee, what that would involve. And it's basically just amending the bylaws to remove that committee as a standing committee. And we would have to vote as a collective to do that. So before making a recommendation that we remove the committee, we wanted to just discuss with committee members and with the board as a whole, how people feel about taking that action. So I will stop talking and open it up for feedback or questions.
I think, Serena, when this was, that committee was formulated, we really were not as well resourced as we are now. And we were in the midst of not having the type of engagement with the community that we have now. And I dare say that, you know, without any major negative comments to anyone else, we didn't have the leadership of the health department that we have now, who really has been inspirational in communicating. So we're in a new realm now with the health department. And we are nothing but impressed with the communications, the strategies, the materials, the methods of getting this information out. And so I think that this is timely, Madam Chair, to remove that as a board committee, because the work is being done and it's being done in the yeoman's job.
Thank you, Dr. Ross. Timothy McBride, your hand is raised.
Yeah, I agree with Dr. Ross. I think I really applaud the work of Lisa and, Harold and others, and, with Dr. Monty coming on with her incredible communication skills, it's sort of taken us to a new level. I think, we probably should recognize that, it's sort of there. Maybe that we can just kind of look at what communication is doing and embedded in the other committee's work. Seems okay with me. I'm not, I don't object.
Thank you. Other comments or questions related to this?
I just had a comment, Serena. That will leave our board with 2 committees. It has been a standing practice of our board to ask our board members each to serve on a committee. So we have 2 committees for people to serve on. And I'm really not sure that those 2 committees, the governance and nominations and the academic, what is the other one called? Academic
Partnerships.
Thank you, the academic partnership. I mean, those committees may not have a wide appeal to our board members. So one question that I have is, or questions that I have are, do we think 2 committees are satisfactory? And if not, are there other committees that we feel this board might need? And do you and Dr. Maddie have any thoughts about other ways in which our board could be meaningfully engaged, other than having just these 2 committees?
Definitely, yes. And so that's a part of what I'm hoping, once we have the orientation and we have a very clear understanding of that, the strategic plan, the community health improvement plan, I think that there's an opportunity to establish committees that really align with the long-term work of the Department of Health. But I agree that 2 committees is not enough, and they may not be the 2 committees that would really leverage the skills and expertise of the board, especially the board that we're building as we recruit new members. So I think there's an opportunity for us to discuss which committees make sense based on the strategy and the action plan. The conversation about the communications committee is really about whether or not there is a role or a function for the board to play as it relates to communication strategy. And it seems like, to the earlier comments, that the staff is really in a good place to lead that, and there may be other places for board to lend our expertise. And I see, Dr. Mata, you have your hand up.
I couldn't agree more with Serena. I think that this is a great time. And I love her approach and her leadership in general, child. But I love her approach to considering that we wait to see that we get everybody on the same page as far as orientation goes, and understanding where the health department is now, which is in a very different place from, a few years ago. I do have ideas, and I'm scheduled to meet with Dr. Ross and Serena and Dr. McBride soon, but would like to also see us maybe look at something that's more community engaged, and even in reconfigure, the feedback mechanism that we've talked about as well, or an accountability piece as well. So there's multiple ways that we could do this, but I just completely back and agree with Serena about the approach ahead. And I just thank you, Linda, for being thoughtful and intentional about thinking about that, because I agree with you, the two committees, again, may not serve the board and the community in the way that we choose to. But I think Serena's approach to not rushing towards just picking anything is important as well, because we want something that has sustainability.
Excellent. Could somebody drop a reminder in the chat for our orientation date? I think that might be beneficial for all board members, even though it will be geared toward our 2 new board members. I think, we would all really like to hear about orientation from Dr. Mahdi about the department and all the work that is going on.
Will do. I will search. I think I have that. I'm looking to see if Craig is on. But okay, I have the date. I just have
It's
to
October 4th, and I think it's at 8 a.m. if I remember correctly. But I'll ask one of the PIOs that see Kim always,
That's
Kim's
what I
always
have,
going
October 4th, 8 a.m.
on it.
All right.
Thank you.
All right. So if there's no other discussion about the Health Communication Committee, I will turn it back over to Dr. Mahdi for the departmental updates.
All right, a lot of exciting things going on. I'm going to ask Kim to share slides. We've been sending you these slides now. I haven't gotten any feedback, so I'm just going to assume people are happy. That's a lie. Dr. Ross always gives me feedback. So Dr. Ross gave great feedback. Serena gives me feedback. But if anyone else has anything to say about these things that are helpful, not helpful, don't hesitate to email me. I always love feedback that will improve things. So this will be our August 2022 City of St. Louis Department of Health departmental updates. Advanced screen, next slide, please. We can go past this. So we're gonna spend a lot of time on this, on our emerging issues and what we call high impact items. Basically what's new with the Department of Health. So I am thrilled to announce that I hope many of you saw in the press that we just recently announced that we have a new Commissioner of Health, Ms. Victoria Anwuri, who will be joining us at the end of this month. She has served for 9 years as the Associate Director for the Institute of Public Health at WashU. She is dedicated to equity, to community engaged care. She has extensive knowledge in running an incredibly large budget, contracts, grants at Washington University. Her leadership cannot be overstated. And while there were some truly excellent and diverse applicant pool, I think we were intentional in our interviewing process in prioritizing someone who could really fill a much needed role in the priority I have for addressing the organizational infrastructure, key performance metrics, and just improving the way that we address our programs as well. And Victoria's over 20 years of experience will more than support that. So I just want people to unmute and just show some congratulate and welcome Victoria. She'll be joining our next board meeting and I'll introduce her formally, but just really, really glad to be able to announce that. All right, the air claps are duly noted. I will move on to, we are going to be announcing within the next month our new Behavioral Health Bureau, but the key first project within it is to address the opioid crisis that has plagued our nation, our region, and certainly our city for decades. As such, I have partnered with the CDC, and this just goes to show how you can leverage relationships to really do high impact work. So I knew, I had done work with CDC National prior to my role as the Department of Health and the White House Task Force. When the director, Walensky, was slated to come and give grand rounds at WashU, her team reached out to ask for a meeting with me, 1-hour meeting while she was in town. I was cheeky and took the initiative to instead request 6 hours. And as you remember, that was an incredibly fruitful time for the health department. She got to tour all of our programs. She got to meet staff. Staff really led the visit. We put the staff in front so that they could get the appreciation that they don't normally get for the work they do. But I also was intentional about making sure that she made it to North St. Louis, toured a federally qualified health center, and met with all of the CEOs of the FQHCs. For me, it was important. The theme for me in my mind in preparing this was equity in action. And just really having her understand, we were the first health department she'd ever visited in her tenure. And it has yielded a lot of fruitful partnerships. But one of them has been during my 1 hour meeting, the original 1 hour she asked for, I pitched a lot of where we would like support. And one of those is that of the 3 non-COVID priorities that the city has related to public health, behavioral health is one of them. And we don't have one person in the department hired to do this work. All of the work that the city health department has done around behavioral health has been through contracts or subcontracts, which is not enough. And so we will be announcing a new bureau. There will be a press conference within the next 4 to 6 weeks. But as part of that, we will be addressing this opioid crisis. And she really delivered and came back. And the CDC has pledged to fully fund 7 employees towards the opioid crisis project. So we have hired and they have started this week. I will do a pointed presentation to kind of introduce you to what we're doing in that space at future board meetings. But we have hired a program director, a strategic planning coordinator, a data analyst, an epidemiologist, an equity expert around the opioid crisis, and 2 other positions to round out this team that will be building the strategic plan, mapping out behavioral health services as they relate to the opioid crisis, doing and expanding the data that we do within the health department around this. They will also be building and implementing a plan for the opioid crisis. I'm also pleased to announce that I've secured $400,000 for this year to support this program, and a pledge from the states for $500,000 after the fact. So without impacting taxpayers' dollars in any way, we've already started to get an operational budget for this endeavor. So incredibly proud of that. This is a much needed area, will grow our health department, and more so will help us to immediately impact the work. You will have seen yesterday or the day before, my days are all muddled now, being that I'm traveling, we announced that we partnered with Prevent Ed and Peoples and multiple other community organizations to put naloxone boxes that are secured in all the recreation centers in the city. So this is one part of showing what this impactful work can look like. So more on this soon, but very excited to announce that we have these 7 really high tier CDC national level employees that are fully funded with benefits and pay through the CDC. Monkeypox is another emerging issue. We have continued our canvassing and our online and now nationally acclaimed education efforts. We have a monkeypox toolkit on the website. I'll ask Kim to put the website link for monkeypox. It's a one-stop shop for everything. We give you daily updated case counts on monkeypox. We give you information, videos that you can share. We talk about how you can sign up for vaccinations as they become available. But most importantly, we have this toolkit that you can download at your entities. We added education that went out this week for pregnant women and people who bear children. Lastly, I'm also proud to announce that the City of St. Louis has taken the leadership role in having the first mass scale vaccination event for monkeypox. Demand is high, vaccinations are unfortunately low in the state, but we're having 2 full days of vaccinating folks in the city, right at the health department, all day Friday and Saturday. People have signed up. We have over 25 volunteers who will be helping with this event. The mayor's office will be attending in my absence. And I'm incredibly proud of my staff who with little capacity have continued to really meet people where they're at. So this will be the first mass scale vaccination event for monkeypox in the region, and it'll be happening at the health department this Friday and Saturday. I also wanted to let you know that, the next topic is a partnership of which I'm incredibly proud. When I was being interviewed for this job, one of the main parts of my interviews was really talking about the fiscal difficulty the health department has had for many, many, many years around executing contracts in a timely fashion and paying our partners in a timely fashion, and other fiscal responsibilities. So I utilized unpaid salary money, which is unfortunate, but at least there's a positive thing that came out of that, to go into partnership with a top accounting firm in the city that has experience with City of St. Louis fiscal activities. They are going into just under a 1-year contract with us, and they will be doing a full assessment of what we're doing. They've been meeting with all of our accountants. They're on the ground. They're having meetings with other departments who work with us. They're meeting with external partners. They're helping us implement much needed organizational infrastructure, trainings, and providing the groundwork to really make sure that our fiscal department gets the support that it's so badly deserved, but improves our overall functioning in general. So incredibly proud of this partnership. I'm thankful to the Armanino team who meet with me bi-weekly, who I'm in constant communication with. They've already helped us with high-level deliverables for activities that are happening on the ground right now. Last but certainly not least, I have undercover been working on a health equity plan for the department. I do not believe that equity is something that is separate from, I believe it is included in every facet of the department. So rather than just have a separate entity for diversity, inclusion, or equity efforts, we have been building a comprehensive strategic plan with timelines, sustainability pieces, and deliverables that we have shared with key partners to provide feedback. And you will be hearing about that before the end of the year. We will be debuting that. Many thanks to Julie Gary, Dr. Dominic Moshe, and our team who have done the incredible work of that. So most of this departmental update has been on this slide, but I think it's important for us to spend some time. I'll spend a little bit of time through the rest of the slides and then open it up for discussion. So next slide, please. COVID-19 we discussed, so I'll move to the next slide. So monkeypox, this is some of the data that you'll see on our website, but just to say that currently the City of St. Louis has 30 cases, 18 confirmed and 12 probable. 62% of the 30 reported cases are white. However, 7 of the last 12 cases have been African-American, and this trend is a trend that we've seen across the country where 99% of the cases nationally have been in men. 94% of those have been in men who sleep with men, MSM. But we are quickly seeing that, as we see in every entity, because this is a constant and long-term issue in health disparities, that Black and Brown communities are now being disproportionately impacted. So we're excited about the fact that we're providing vaccine and that we have access to both testing and treatment through our FQHCs and other partners. Next slide, please. Violence prevention efforts continue in partnership with the new Office for Violence of Violence Prevention. We continue to monitor high-risk individuals under case management, encourage community events, and then we really like to look at potentially violent interruptions that have been, potentially violent interactions that have been interrupted and by trained violence interrupters, and those have increased by 50%, which is exciting to see. You can see monthly reports on violence prevention on our website. Next slide, please. We talked about the Behavioral Health Bureau. There's EPI related to this that I will trust that you all will follow when we send these out. So I'll go to the next slide. So let's talk about our public information and health promotions. In August, information regarding monkeypox and area flooding were promoted heavily via social media. However, flood response was the primary topic during the month of August, ensuring those who were impacted were connected to available assistance. I have started a weekly in an attempt to diversify impact and communications in the way our chairperson, Serena Mohammed, always encourages, and Dr. Ross has been advocating for many years. I now have a weekly radio spot with 105.1 at 9 a.m. where I just talk nothing but health for 30 minutes. We take questions on live, but also around the time as well. So that's been a great addition to that. But I just want you to look at these numbers that my team have consistently seen gone up. Look at the Instagram reach in August alone that's increased by 90%. They have consistently been seeing us widen our reach people where they're at. And what's exciting about this is that means we're reaching a younger demographic too. But it's important that we note that, that means that, there's still an equity component of folks that don't have access to internet reliably. So I'm also reaching out to the Board of Aldermen to ask that I do throughout the year, every month, at least one neighborhood meeting where people can see me in person, ask questions in a town hall format. So more on that to come. Next slide, please. Fiscal and payroll, we talked about. But when we talk about hiring and turnover, I'll just say in August, 5 people were hired, bringing the total number of people that have been hired during my tenure to 38 people. To date, we have 79 open positions still though, due to the addition of 5 positions in the budget. The turnover and quit rates both dropped for the month of August. So really trying to be intentional about retention. But when I say I've broken records in hiring people, 2/3 of that number have left during that time. That's no way to keep and maintain a health department. So that retention piece is one that I would love to hear feedback and ideas about what we can do to continue to do that. But seeing that trend come down has been really encouraging in the health department. Next slide, please. So I'm going to leave it to you to spend more time in the specific bureaus, because we spent a lot of time in our emerging issues, but just to say that we continue to have goals and give you metrics around what we're doing for each of these bureaus. For communicable disease, our completion rate that we're really proud of for communicable disease case investigations is 97%, but the team is just really heavily engaged in monkeypox right now. Next slide, please. And I'll let you keep going. Folks can follow up on hepatitis and TB. Again, just so that you know, one of our main areas is in health equity and men's health. I want to draw your attention to the top right end of the screen. This is what happens when you have a chairperson who is assertive. We've been asking people to really reach out to us where they can help through these reports I now give you. We told you that we had a distinct need. We're having a really tough time hiring nurses, specifically for women, children, adolescent health. And so through our own board member, Dr. McNichols, we were able to, she met with us, and Planned Parenthood is now committed to a partnership to assist with the Show Me Health Women's Grant that is moving forward steadily. I see the smile on Serena's face. We are buzzing over here at the health department. This is what happens when we have board members that are engaged, that represent certain areas. This is what it should look like by way of feedback and power partnership. So I challenge all of you to make sure that you get your name on my slides in the next couple of months through partnership, through action. So just really wanted to shout that out, and you can look at more of the other things that we've been doing. I do want to spend a little bit of time on this slide though and talk to you about our food RX, really addressing nutrition needs in the city, a big equity need for us. We handed out 15 prepackaged food bundles to Promise Zone City residents to encourage healthier eating habits through our cooking demonstrations. This is such such a creative and wonderful way to teach nutrition's on the ground cooking demonstrations with chefs is just a fantastic initiative. Our men's health collected 16 additional PCP engagement surveys to help our goal of 100 for 2022. And then again, this potential partnership with Planned Parenthood is something we're truly excited about. Next slide, please. So I'll let you catch up with what's happening around lead and asthma when we circulate this. So we can go to environmental health services next. So we're continuing to catch up and process all of August food and beverage permits, renewals, and special event temporary permits. While this sounds like a boring update, this is the work of public health, and people need to know what else we do that's not catchy. This is important work. We continued updates of standing operating procedures for food and beverage control, covering outbreak investigation, food product embargoes and recalls, and foodborne illness investigations as well. The decreases that you can see should worry you because, again, hiring for environmental services, and I'll speak to you specifically about animal care and control, which I'd like to go to next, is an issue. So we have 2 animal care and control officers registered to attend our annual Missouri conference, but we're continuing to provide these services. But really, we are in crisis when it comes to animal care and control. I had an emergency meeting with the mayor's office, our Department of Personnel, and an external partner to really address some key things. So this is where I need help, board. If you're playing solitaire, if you're responding to emails, now's the time to reconnect with me. I need help for animal care and control. If we do not address this as a matter of priority, we may no longer be able to have services. We are in crisis. We're in crisis because it is really difficult to hire animal care and control officers. Many thanks to the Mayor's Office and Department of Personnel who provided me with a signing bonus of $1,500. And we are looking at increases in salary across the board for our animal care and control. So very many thanks for that, for their partnership in trying to address that. However, it still takes time because these people need 6 months of onboarding because they're in very dangerous situations. So what we need is for you to send us people who could work in animal care and control. We need help finding a new building for Care STL. They are overpopulated, which is making it difficult for us to address the needs of animals in the city. We have an external partner who has identified a potential building, but we need help and funding availability as well. So please reach out to me directly if you have contacts or knows ways that we can really help animal care and control. I'm interested in even contracts and subcontracts for people who can help with training, who can partner with us to provide services until we're able to build that team fully. But we are in crisis. Next slide, please. Our accreditation activities are going well. This is to ensure that we meet or exceed the PHAB standards for reaccreditation. We are working on the Community Health Improvement Plan, or CHIP, taking a regional approach by working in collaboration with St. Louis County. And our activities have been continuing well in that regard. This is the last slide now. You will have this in your monthly update. So just to tell you where we're gonna be, where I am, this is to foster collaborations for the months ahead and to give us ideas. If you don't see something for October, for example, or even the remainder of September that we should be a part of, this is a way you can give us feedback as well about where I should be or where the health department should be as well. So I will stop there and take any questions.
I want to thank you for a comprehensive report. It's just pretty remarkable what you and the staff are doing. Oh, you know what? I just like start talking without raising my hands. I'm sorry, Colleen and Tim. I could be really rude. I'll be less rude the next time. So a couple real quick points since I was rude. First, regarding the attrition, is there a process for doing formal exit interviews with outgoing staff so we can really have a systematic way of identifying those areas? We've talked about them before, salary and other issues.
Thank you for that, Dr. Ross. Let me address that first, and then I'll take your follow-up questions. And quite frankly, as the senior ranking and originator, you know, I think you are exempt from a raising hand at all times. I can say that confidently, and I see people raising their hands in agreement. So
I'm going to follow the rules the next time. I'm not going to do that anymore.
But in regards to that, that's such an excellent point. I implemented an exit interview to standardize across the board around January or February of this year. So we get feedback and therefore data. I think you all see a theme with me. I'm a very data-driven person. And it just helps us see where the issues are. Consistently, what we hear back is it's about salary across the cities. This is an issue the mayor inherited. She increased 4.5% salary increase in July with a $2,000 one-time bonus as well. But we're still far off from an equity, from salaries in the city being equitable to what our partners privately have. And then benefits as well, you know, above what they're seeing in equity, what they're getting outside, work from home almost exclusively in a lot of places, higher salary and better benefits is really hard to compete with. And then the second thing that is ranked across the board from our exit interviews is burnout. Because again, we're so understaffed. Most people are doing the work of 3 to 5 people. So I have a lot of people who say, we love you, we love working with you, we appreciate your leadership, I just can't do it anymore, is what I get back a lot of the times. There's some other variations to that theme, but overwhelmingly, those are the top 2 reasons. Back to you, Dr. Ross.
Okay, that's a real quick one also. And I think we're fortunate, I think the country is fortunate. I think we've dodged a crisis with monkeypox. It's not over, but we've dodged a crisis. But what we haven't dodged is the fact that there are too many families that aren't taking their kids to get vaccinated for the usual cases. Those cases of polio frighten the dickens out of me, and they can happen here in St. Louis. And so I'm just curious, where are we with usual vaccination rates in St. Louis?
So as you know, we were given the largest allocation of vaccines in the region at 1,900 vials. However, it's not nearly enough. So we can only vaccinate high-risk individuals at this point. I've now met with HHS and Congresswoman Bush, who have been doing advocacy. We've been speaking with the state through MOSEFI leadership, which is the leadership that convenes all the public health directors in the region. And we are seeing at the federal level, you've seen the news show an influx of vaccine vaccine availability, and they're trying to provide direct access to community organizations. So my hope is that we'll see that expand, but we just haven't been given a formal indication of how that will happen. But your point is well taken. While we're not in nearly the level of crisis we were in with COVID, we still must not ignore the significant impact and therefore morbidity and overall decrease in health and wellness for the LGBTQIA+ community, and again, Black and Brown communities who've been disproportionately impacted. And one, to get ahead of what we saw with HIV and AIDS epidemic in the 80s, where that's lack of addressing stigma at the onset has continued to plague us to this day. And so just continue to be really impactful there. But again, until we get a much higher number of vaccines into the region, we will be unable to meet the demand and the needs that you've highlighted, Dr. Ross. And so that's my monkeypox advocacy for vaccine is basically my daily job at this point.
Dr. Ross, were you asking about monkeypox vaccines or?
I was asking about both monkeypox as well as the
childhood vaccinations
vaccination in general.
So a comment on childhood vaccinations in general, based on, and thank you for that clarity, Chairperson Serena, but we've seen nationally that immunizations for children across the board there are trends across the country of them decreasing. We've seen cases of things like polio that we shouldn't even be talking about because they're completely preventable, and we've had safe and effective vaccines for the longest. And so we have been talking with leadership. I've been on a school leadership tour, and talking about education around childhood immunizations. We have a sustained campaign. So throughout the winter, the priorities from the Department of Health are going to be any emerging issue, our Behavioral Health Bureau, and then childhood immunizations, flu and COVID immunizations throughout the winter. That's basically where we're focusing our attentions.
Thank you.
All right. Colleen, did you still have a question?
Actually, Dr. Ross asked my question. It was really around the monkeypox availability for the vaccine.
Great, thank you. Dr. McBride?
Thanks. And I will just say again that I really appreciate how great that presentation is and how thorough it is. And I've been on this board long enough to be on there before the pandemic. And we spent a lot of time looking at a lot of those other aspects of what public health does. So I'm really think it's important that we elevate this. I had a specific question about STIs, and because I saw a story just now, the CDC said that the rate went way up significantly in 2021. I know you mentioned HIV in your presentation. Are we seeing trends in St. Louis that we need to be worried about?
Can you say that again? My internet went out a little bit.
Oh, sorry. I saw a story. The CDC is saying that STD rates in the US went up 26% last year, and it was a pretty high increase. And I was just wondering about what we're—
Yeah, for taking minutes, and also I'll talk to you and Serena about what you'd like me to do by way of pointed topics in the following board meetings. We have a crisis around STI rates going up. We did a joint statement with the county about 6 to 8 weeks ago. I can bring that back, but we also have some really staggering data about how STI rates have gone up in our region, even through the pandemic, and specifically around the issue and crisis around congenital syphilis, the rates of which have gone up by more than 300 to 600% since 2017 and 2018. So the county has asked us to partner with them in doing some research around this with hospital partners who have joined on to the hospital systems or with us, but also to do some very pointed interventions as a result of this crisis around congenital syphilis, as a direct correlation to the consistent but now increasing trend to STIs in the region. So I can do a dedicated presentation on that in the coming weeks. But this is something that is here with us and very serious.
That's fabulous. And, again, I'm just applauding the overall comprehensiveness of the presentation, but that one is one that's worrying me quite a bit, as well as the animal control one that you mentioned.
Yeah, as it should. Thank you for that feedback.
Thank you. Lisa, you have your hand up.
Thank you. Dr. Marty, we're going to get that slide deck, right? I couldn't read fast enough of all the
Yes.
accomplishments.
So
Thank you.
you've gotten it the last 2 months and you'll get them. There's just so much to go through that I try to focus on different pieces each month. But just like you did the last 2 months, we will send these out. You'll also get the PDF for the COVID slides and a dedicated monthly monkeypox report as well. If there's anything else going on, I send that as well. But those are the things that you can expect that will come with that.
Okay, great. Second question, who's your staff person I can call about the animal control crisis so I can get some ideas on how I might be able to link you guys up with a few resources?
That'll be great. If you could email me, and if you have Justin Hauser's email, he's the bureau chief. So it'll be
Okay.
me and Justin Hauser. Kim, if you could put Justin's email in the chat for folks, but you can email both of us together and we can get moving on that. I appreciate you reaching out.
Great. Okay, let's see what I can do. Thank you.
All right, other questions?
Please see Justin's email is now in the chat for anyone and for all of you to please copy and paste since you know this is your homework for the month.
All right, thank you, Dr. Mahdi, especially for joining us while you're out of town traveling. We appreciate it. Okay, any old business? Don't think so. So the only announcement that I have is that we will not have our regularly scheduled October meeting. We will be having the board orientation, which we've mentioned. We won't convene for our regular meeting again until our November 17th meeting. So in the meantime, stay tuned to your email because we'll be sharing information and updates as they arise if there's anything time sensitive that happens in October since we're not meeting.
And you'll still get my departmental update reports for October.
Great. All right, if there's nothing else, I want to thank everyone for your participation and commitment, and I look forward to seeing you all at our next meeting. We are adjourned.